attachment है. So when you are doing it or palpating it, you will feel कि muscle belly यहाँ से raise हो जाएगी. So you can find out the point. So the trick in doing the needling in this muscle is you will find the muscle by resisting the knee flexion. When it bulge out, you will know where to insert the needle. And the angle is perpendicular and the penetration is up to 1.5 to 2 ch. Okay. So the next muscle we're gonna do
knee
is
knee is going to be in the extended position.
Once you find the point, then you can relax. You don't have to keep it flexed. You'll just use it for finding the point, and then you'll ask the client to relax it. Okay. So the next point is semitendinosus. So semitendinosus and semimembranosus, if you see, are more on the medial side of the thigh. So the point would be bit medial. I will show you the landmarks on another picture after. So the landmarks will remain the same. The one we used previously. The vertical distance, half the vertical distance between greater trochanter and popliteal crease. And the point of insertion, now your measurement skills come into the play. You will be going 2 chan medial and 2 chan superior. Okay, so from this point, the green point, I will go 2 chan medial and 2 chan superior. So pretty much here. Okay, so on the medial side. And angle would be perpendicular and penetration would be 1.5 to 2 chan. So the penetration for all 3 muscles of the hamstring are same. 1.5 to 2 chan. And angle is same at 2, perpendicular. So that's easier to remember. And the next one is semimembranosus. For this one, the point is a little bit lower than semitendinosus. So it is also medial, but it is 2.5 chan medial, so slightly less medial, and 3 chan inferior. So 3 chan is inferior. So you're gonna use your finger to find the points based on the landmarking. And the angle and penetration is same. So it's good?
Right.
So should we do the quadriceps with it, or you want to get it demonstrated with it and then move on? Or we can cover the points and do it together. Okay. So now we're gonna do the quadriceps.
We have 2 heads of bicep muscles.
Yes. So the one that is more superficial, longer one, we're gonna hit that. It bulges out.
Research कहती हैं कि जो इसका short head है उसमें ज़्यादा जो है वो
contraction. Yes. So again, now the one that is easily approachable is the one we're gonna hit, and it will give us enough contraction. We'll show when we'll do the IMS, intramuscular stimulation. You'll see it is giving us enough contraction, so we're good with it. At least it will stimulate the whole muscle. For quadriceps, vastus lateralis. For landmarking, everyone knows where the center of pedal is, so easiest landmarking. So that would be very easy. And second one is lateral surface of greater trochanter. So if you see the red mark, we have already marked the greater lateral surface of GT. And the point of insertion is half distance from landmark from 1 to 2. So whatever is the difference, we go half, and we'll move one from landmark 1 to 2. We'll move to the lateral side of the thigh because it's more laterally located, right? So you can see it is right on the edge of the thigh. So it would be a little bit center, so we'll move a little bit toward the lateral side of the thigh so we can insert the needle. Angle is perpendicular and the penetration is 1 to 2 chan. For vastus medialis, that is a little bit tricky. So our landmark is same, center of patella, you can see here, and then the second point is medial joint line. Easier marks, and then you will measure the distance between these 2 landmarks. Then you will make a 45-degree angle, and then the equal distance that was from 1 to 2, but at the 45-degree angle above the knee. So if you see the picture, you can see that's pretty much the belly here. That's where we're gonna insert the needle. Okay, so it's easier to understand, or it's a little bit complex. I would explain it when I demonstrate it. Okay, so here the angle is not perpendicular. The angle is oblique, but which direction? Medial or lateral? We will gonna do medial to lateral. So we'll be inserting the needle medial to lateral in oblique direction. And penetration is 1 chan. So it's not very deep. It is just 1 chan. So we might be using the smallest needle. Okay. So the next one is, so that's rectus femoris. Okay. So that is also very easy. The landmarks are ASIS and center of patella, and the point of insertion 1/3 distance from landmark 1 to 2. So you will move from down to upward, and 1/3 distance right in the thigh, in the front. So the angle could be perpendicular or oblique, but oblique superiorly, so up toward the head. Okay. So but perpendicular is fine too. and penetration is a little bit deeper, 1.5 to 2 chin. It's all good. So we're gonna do it practically, demonstrate it, and then we'll practice it. Okay. खत्म कर दिया? Okay. So let's move.